Thank you, Joanne. Appreciate the introduction. And Professor Roma, I was smiling as you were talking because I spent 3 years at Grand Challenges Canada, where Gerhard is a fabulous board member. And since we spun out an investment fund focused on technologies that help women, children, and adolescents and drive specific health outcomes along that are quite aligned with your priorities, I must say. And so the perspective I can bring to the table is one where when you were mentioning, the ambulance service, I've seen a number of business models that are very effective at delivering care and decentralizing ambulance service in a way that's completely different to what we would do if we were building it in Canada or the US. But that have been found within the Grand Challenges Canada portfolio to be very cost effective and to drive health outcomes. And the other thought I had as I was hearing the conversation, and I apologize, they'll be in a few different pieces, but technology can be part of the solution when you're trying to select, these nurses that are trained and trying to launch a business in their own communities to deliver healthcare. What we see in our world are a number of technology platforms, some local, some international, that can be used both for the training and quality assurance purposes. Because again, when we're scaling up healthcare, quality assurance is really a key component. And a bit later in the discussion, we'll talk about an investment that we're making in the cancer sector and one in the maternal health sector. And both of them have that component where the technology, through artificial intelligence, provide a central healthcare systems operator with a dashboard that helps them see whether specific health practitioners are consistently making mistakes and require additional training on particular aspects, and which ones are the best of the best that can be the trainers for the others. And finally, the last piece I would say is when selecting technologies, what's really missing, I find, in a lot of ecosystems is a number of very good intermediaries. So fund managers that can help select those technologies and put their own money at risk. As a fund manager, every time I make an investment in a company, I need to cut a check personally. And so I'm deeply aligned with the founders of the company that are putting, blood, sweat, and tears in growing their technologies and know the market well enough to figure out, are they meeting a need, and in this case of healthcare, a healthcare need, in an appropriate way? And is this a viable business model? Because they're devoting their whole life to this business. And I, as a fund manager, then invest my own money alongside with monies provided by those who invest in my fund. So groups like Gerhard's firm, for example, if they invested in my fund, that's my pitch, Gerhard. So these are some of the elements that I can provide. And of course, I think on the technical assistance point of view, what we need to ensure our impact portfolio is successful at delivering on its impact is connections to the groups that on the ground, Dr. Roma, that could use some of these tools. And so they can evaluate if they're useful to them and then perhaps use them. We have impact agreements with all of our companies. They're willing to go to the African continent and support that. But we need those connections to your private sector, to your public sector for the users. And if the tools are not useful, guess what? We've probably reviewed 10 other similar technologies, and we are very happy to point you in a different direction to look at new and different technologies. So I'll just pause there, but these were my reflections. Thank you, Joanne.